Welcome, everyone. Thank you again so much for joining us for the Moving from Good Intentions to Concrete Action, Creating Trans-Affirming Services and Grant Initiatives webinar. We're really glad you're here. We promise that you will get a lot out of today's webinar. I do want to let you know that the webinar is being recorded, just so you're aware of that. And the audio recording or the video recording will be available after this webinar on our website, and we'll have that available for folks who want it. You can spread it around to anyone who is not able to make the webinar. Do feel free to call in using the number on the right side of your screen, or you can listen on your computer, whichever works better for you. And the webinar is in listen-only mode, just so you know, so please put any questions you have in the Q&A box that's below where the phone number is on the right side of your screen. So without further ado, we're going to go ahead and introduce ourselves so you know who you're going to be listening to for the next hour. So my name's Shannon Weiss. I'm a program manager here at AIDS United, and one of the initiatives that I oversee is the Transgender Leadership Initiative, and my pronouns are they, them, and theirs. Maury, do you want to introduce yourself?
Sure, thanks, Shannon. Hi, everyone. I'm Maury Reardon, and I formerly worked with AIDS United as vice president, and am now doing consulting with AIDS United, funders concerned about AIDS and some other folks. And I just wanted to say I'm really excited by the kind of level of folks' interest in this webinar topic. And it's an exceptional effort that took place in the field, and just really excited to share it with all of you. Thanks, Shannon.
Thanks, Maury. Diana, how about you?
Sure. Good morning, everybody. My name is Diana Feliz Oliva, and I'm currently the Transgender Health Program Manager at St. John's Well Child and Family Center in South Central Los Angeles. And I'm also a person living with HIV for the past 17 years. And I'm a current member of Positively Trans, which is an advocacy project under the umbrella of Transgender Law Center.
Thanks, Diana. So just wanted to give folks who may not be familiar with AIDS United a quick overview of who we are. So AIDS United's mission is to end the AIDS epidemic in the United States through strategic grant making, capacity building, policy, technical assistance, and formative research. So here are a couple of the things that we do. We try to be as responsive to federal, state, and local policies, especially those related to people living with and at risk for HIV. We invest in innovative models related to HIV/AIDS. You can see there that we've given more than $104 million in direct funding and leveraged an additional $117 million to increase the capacity of communities and organizations responding to HIV in the United States. And we inform the field with best practices and lessons learned, both from our own work and from others' work. Here's some of how we do it. So we advance the advocacy based on sound public policy. We also do strategic grant-making work. We've got targeted and tailored capacity building for organizations responding to the epidemic. And we have research and evaluation that informs the field. And we do work in a social justice framework here at AIDS United. And we look to challenge the foundational issues of racism, sexism, homophobia, transphobia, socioeconomic inequality, gender discrimination, and stigma. It's a very important part of what we do here. So in today's webinar, we're going to be introducing all of you on the call to the concept of meaningful involvement. We'll be explaining AIDS United's transgender think tank. We hope to familiarize you with stepping up the consensus statement of transgender leaders around HIV services and funding that we put out over the summer. And we'll hear from the transgender think tank facilitator, that would be Maury, and one of our transgender think tank participants, who will be Diana, about practical ways to make your organization trans-affirming. So we're going to go ahead and get right on it. So go ahead and Maury, take it away.
Great, thanks, Shannon. I had the honor of facilitating the Transgender Think Tank, which took place last December in Detroit. And I think just a few kinds of context matters, and that is for folks to know that the idea for this was to really carve out a space for transgender leaders in the field of HIV to share their brilliance, their life experience, and really use muscles of leadership in a way that was very much warmly invited and wanted, rather than what happens too often is we see transgender leaders who are invited to tables, and they can be kind of the token transgender voice in the room. And we really wanted to gather folks for a couple days and have them drill down on some very specific issues that impact the lives of transgender people living with HIV, and this was an attempt to do that. And when we share about this model, just something to keep in mind is that I think this think tank model is something that can be used across issue areas. It can go beyond what we explored with folks, and you can convene trans leaders on all kinds of issues in your community. And you can also convene other populations and communities. I think for communities that face the greatest oppression, that continuing to work towards getting voices at other tables is important, but sometimes it's also important to carve out your own space and really have that space to come up with some messages that apply to a lot of folks in the community. And I realized I want to just quickly give a shout out. Diana's on the webinar as a participant, but I want to let you know just quickly the names of the other transgender think tank leaders who were in the room. Some of them are on this call, and I want them to know we see you. That includes Bree Campbell, Achim Howard, Teo Drake, Cecilia Chung, Tiffany Woods, Dr. Scout, Noelle Newsom, Liam Winslet, Maddie Jim, Nikki Coma, and Tiami Luckett. So what I want to say is also about this group that came was we lost some folks who couldn't attend because it happened during a blizzard, but we felt really happy with the folks we did have. And I think it's important to say that among the folks who did come, 90% of those are living with HIV. 70% of those were trans women, and 70% of the participants were people of color. So there was a very intentional effort to find leaders that really reflected the impact of the HIV epidemic among transgender people. And I think what meaningful involvement means is that you are embracing and understanding that you will only succeed in service to community when that service is truly informed by the community. So, we have, in the field of HIV, we have MIPA principles, meaningful inclusion of people with HIV to kind of fall back on as a compass. So meaningful involvement of people of transgender experience. And, there's a long history of this before MIPA, before we knew, there was HIV, before, MIPA was an amazing kind of set of principles. We can go back to Stonewall. We can go back to, the heroes like Marsha P. Johnson, trans women of color who led the way at the Stonewall riots. So there's a long history of leadership in the trans community, and I think this was just kind of an attempt to channel some of that amazing leadership into the same room for 2 days. I want to hand it off to Diana now, though, to talk about what it meant to her to be a part of that meeting and what her experience was.
Thank you, Maury. This is Diana again, and I really just wanted to give thanks to AIDS United for convening trans leaders and experts in our communities from across the country that was very culturally diverse, linguistically diverse, and very culturally competent, and strategic and intentional when creating this think tank. So I appreciate your efforts. Meaningful involvement is very important for trans communities, specifically for grant funders, program administrators, or developers, or presidents and CEOs, because you want to make sure that we create spaces for trans people who you are serving, a community that you are responsible for and you have to serve, but making sure that you create safe and intentional spaces for trans people to come together and have an opportunity to participate in the decision-making or in the influence process that will affect their overall health and well-being. And so this experience for me, it was the first time in my 25 years in the field of HIV that I was actually asked to participate in a transgender think tank, and I was very honored and grateful for the opportunity. And we were closed at the hotel, and we were in there for 2 days, and we really created a cohesive group where we talked about leadership development, and we talked about, best practices. But just having this meaningful involvement process really made a difference because it allowed us to be heard. And sometimes as trans folks, even though we're experts or community leaders, many people that have the political power, and usually it's cisgender people, and usually Caucasian people, and usually heterosexual or gay, but you never have trans people at the table influencing decision-making processes. And I think this was the first attempt by AIDS United, and hopefully, not the only attempt, but I would encourage any CEO or president or program funder or program developer to always include trans participation in the decision-making and in the influence process. The outcomes in the prevention and intervention programs that may come out of that are going to be so much more tailored and culturally competent for the trans community. And we know that the trans community is disproportionately impacted than any other community, so it's very important to receive the buy-in from trans community members.
Great. Thank you, Diana, for that. And I think just to give you an overall sense of the things that were covered at the think tank, one of the areas that we solicited feedback from folks was on leadership development, and I'm going to hand that over to Diana in just a moment. But just to say that, if you've been working in the field of HIV for any amount of time, you know that there are quite a few kind of leadership developments models that come out, and it is really too rarely the case that you see many folks of transgender experience participating in those, and even rarer that you see folks finishing those and feeling good about them and kind of promoting them in their community. And so we really wanted to find out, if it was up to the transgender community of leaders with HIV and emerging leaders, what would leadership development include and look like? And so Diana's going to talk about some of the feedback that came from that.
Thank you, Maury. Yes, so we had a very robust discussion about what leadership development meant for each and every one of us. And some of the central themes or the topics that were discussed that were prioritized during the 2 days was, first was building leadership confidence. Unfortunately, there's a history and there's a pattern in this country that trans people are not valid and not affirmed and never are sit at the table when decision-making processes are happening. And a lot of that is the system that we operate that continues to be oppressive to trans folks, but also that we never attained the leadership skills or civic engagement skills needed in order to feel comfortable and confident in decision-making roles and developing relationships with other stakeholders. So, having the component of building leadership confidence, and leadership confidence we'll demonstrate in different forms, and so we'll go over the bullet points that we have listed here. So one of the skills that the trans think tank members discussed was making sure that our public speaking skills was a priority. Making sure that we can convey our message to funders or program developers was crucially important. We have lived experience, and our lived experience as trans leaders, especially those living with HIV or working in communities most affected, will lead to highly informed grant making that will promote greater and more sustainable outcomes. And so, but we need the fundamentals in leadership development, and that's confidence, and that's public speaking and strategic communications, especially now with the time and the era of social media and how communication is highly important. Developing and learning about strategic communications is highly important for our community. Also, there's a lot of trans leaders now pushing for having trans-led organizations. And so many of them felt that they lacked grant writing skills. And we know that having a very good grant writer will stand out in the grant-making selection process, and making sure that the leaders in the room and future leaders will have the necessary skills to write an effective grant. Also, just program administrative competencies, running a nonprofit organization or working a nonprofit organization, and how do you develop administratively or programmatically, where you can become a director or coordinate particular services. And so having those competencies are very crucial for the development of their leadership style. And then also, which was highly important for our community, and that was discussed for the 2 days, was the priority of self-care. And I really want to underestimate this or overestimate this particular point in self-care, because as many trans leaders, and especially HIV positive leaders, and I'll give you an example for myself, I tend to not take care of my own personal needs because I have 1,800 patients that I have to tend to and serve. So it's really difficult for us to sometimes put our own personal care needs because we're so focused on our community. And so really focusing on self-care and developing coping skills, developing grounding exercises were crucial for future leaders. Also, in the next slide, let me change that. Some of the logistical feedback that we received is that the leadership development trainings or institutes or series needed to be free or low cost, but very affordable to community members throughout the country. Many times, like the Rockwood Leadership Institute in Northeast United States, is a very pricey leadership development training that many trans people, specifically trans women of color, don't have access to. And so creating free and affordable or low-income leadership development trainings are crucial for future leaders to engage and receive their technical assistance and capacity building skills. Also, the application process. Many trans folks get intimidated or experience frustration when they come across an application process because it's very lengthy and you need some references. Sometimes you need a reference from a president and CEO that you work for. And so having an application process that is accessible and seamless is really important for the development of leaders. Also, making sure that the trainers who are going to be training the folks are skilled in trans affirmation and also transcultural competency, and making sure that the trans skilled leader trainers create a safe and welcoming space for everybody. And so making sure that part of the trainer staff be trans-identified. And then also support trans individuals with travel logistics. And so we know that trans community members tend to live in impoverished communities and don't have a socioeconomic level as our cis heteronormative counterparts. And so making sure that in the leadership development, if there's scholarships or grants available for people to attend, that the leadership development trainings include hotel and airfare and per diems. That makes it more incentivized for people to engage in leadership development and just make it a little bit more affordable for folks to attend as well. The next slide, feedback on leadership development beyond the curriculum. So after we provided the feedback on logistics and curriculum, we talked about sustainability as far as being a leader and how do we sustain our leadership throughout the decades. And so mentoring is critical. And so having either cisgender counterparts that have walked in our shoes prior or other trans leaders who have gone through and have successful leadership styles or sustainable careers, having them give back to the trainees in the leadership development. So identifying folks that can be your mentors is really crucial. And having that mentoring empowerment component and pairing them up with a new trainee is helpful for a new leader who may have some anxiety, some insecurities, some hesitations. But pairing somebody with a trans leader who's already gone through the years of developing their leadership and have a long history of work, and then mentoring is critical for the successful and sustainable outcomes of trans leaders. Also, experiential learning is really important. So the hands-on and our lived experience was decided that it was very valuable when incorporating leadership development tools. So really identifying some of our history and our narratives, our personal narratives, and how we can use our personal narratives to develop leaders. And so, and then also create a safe space for self-reflection. And I always include cultural humility in my practice and in my leadership style, and that's part of self-reflection, where you self-reflect, you self-evaluate, you become self-aware of your assets and your debits. And then also, you're looking at the power imbalances and how you can make an influence in those. Also recognize diverse learning styles. Not all people are visual, not all people are audio. Some people are tactile or very hands-on. And so you want to make sure that your leadership development curriculum speaks to different learning styles and different personalities. And then also you want to make sure that the leadership development trainings or institutes that are created are one of the key areas is that making sure that the curriculum, the trainers, the dialogue is always about having fun. Of course, we want to focus and prioritize on making sure that we have effective leaders coming out of the trainings, but also we want to make sure that we remind ourselves what we're passionate about, what brings us to the table, what's our vision, what's our goal, and also in those spaces, how to develop relationships, personal or interpersonal relationships with each other, and how to have exercises that are interactive or breakout sessions that are about having fun. That we can talk about leadership all day long, but if you don't have moments where you can create spaces for fun and recreation and just social networking, and then you're going to lose out on the personality of the leadership development style. Also, the next slide. Post-training, so it was important that, if someone had completed the leadership development training, post-training would offer booster on key topics. And they can be, ranging from motivational interviewing to public speaking to, additional enhancements, key topics that are necessary for leaders to develop, or reminders or refreshers. And it's very important to offer those afterwards. Also offer individualized professional development opportunities. So maybe somebody from your own organization or the trainer at this leadership development training comes up with a professional development plan, a career plan for these future leaders. So then they have a blueprint or a roadmap that they can always fall back and you can set some timelines and some tangible goals so that incrementally they're succeeding. And that's very important because sometimes we need to see on paper, on our refrigerator magnet saying, okay, I was able to do this in 6 months, and you have a sense of accomplishment. Also, once the leadership development has completed, you want to make sure that graduates have a project so they can present. And this is really crucial. I had the opportunity to participate in the Liberty Hill Leadership Institute, and at the end of my 6-month leadership development series, we paired up in groups, and our group had to do a presentation on a particular topic. And so it would be very important in this leadership development you may develop that graduates have a project that they need to present to maybe possible funders or program developers. Okay, and then of course people that have graduated from the program continue to be a part of the leadership development curriculum and administrative prospects by becoming mentors and making sure that they're empowering, they're grounding the trainees, and making sure that if there's anything that may come up, you know, that the mentors there, the alumni, are there to kind of help facilitate that process. And I think I'm going to give it back to Lori.
Great. Thank you, Diana. You know, it was such a powerful conversation about leadership development, and Diana really covered it. And, you know, what struck me in the conversation was really folks talking about a trauma-informed approach to really kind of approaching leadership development and designing it. And that's why it's so important that transgender people design their own leadership development trainings and not be asked to fit into kind of a cookie-cutter approach to leadership development. And, you know, as Diana mentioned, the piece around fun, I mean, it was really clear and poignant in training. People talked about, you know, our healing is about being together and laughing together and crying together. And that's just an important part of any training you would hold. And then some of the things Diana mentioned about logistics, particularly around things like hotels. You know, we all as organizations have the ability when we hold a meeting to not put folks through that humiliating moment when they have to provide a credit card when they check in at a hotel, and you know, to have the organization put down a credit card, or to say there won't be any incidentals in this room, so don't worry about it. Thinking those kinds of things through, having a friendly, warm, welcoming person come to the airport, and particularly if somebody has to go through, you know, the stress and humiliation that happens sometimes with TSA at airports. So really thinking those things through is critical. And again, you know, why even have a think tank? And I mentioned some of this in the beginning, but it is a way to be very intentional about hearing the voices of transgender people. Again, it gets away from a model of tokenism and trying to fit folks in at a meeting without any mentoring or preparing of them. I think that, you know, those are still tables that trans leaders need to be at, but this really carved out a space for people to feel like I can flex the muscles of wisdom that I have and life experience. And it was just a very powerful model to use. Now, the goals and outcomes that we actually went to the think tank meeting with were, we wanted to hear about Age United, and some of you know this because I see some of the names on the list of folks on the call here. Age United had an Access to Care initiative for many years that funded grantees across the U.S. to improve access and retention in care. And so what Age United wanted was some feedback on the specific kind of successful models of that grantee cohort, to hear how they could be more user-friendly and relevant to trans communities. So that was one of the goals of this think tank, is really getting feedback on that. The other was, you know, getting this feedback we just talked about on leadership development. So those were some of the goals, and the outcomes were that Age United received really great feedback in each of those areas. What wasn't anticipated was that a consensus statement would come out of this. And this was a very organic thing that came out of this think tank. And I think, again, with this model, there are things you just can't anticipate that are going to be amazing. And so there is a consensus statement, and the cover of it was shown on the slide, and it's on the Age United website. And I'm always just really thrilled to say that that has actually been the most downloaded document, I believe, to date for Age United. So it shows the thirst of the community to learn more from transgender leaders. But that consensus statement was key recommendations to healthcare providers, to social service providers, and to funders. And that was just something the group felt passionate about, was it became clear that they had things to say to each of those groups. And so folks said, why don't we develop a statement? and we thank you for the slides, Age United. And the statement is called Stepping Up, and you can find it on the Age United website, and it makes recommendations to those groups. And each of these amazing leaders signed off on that statement, which made it even more powerful, is I want to put my name on this. And honestly, since that statement came out, there have been other trans groups, organizations, and leaders who have asked if they can sign on, that it was so powerful. So that's just something that was unintended and has been an amazing resource for the community, I think. And Diana talked a bit about what it meant for her to be a participant in that. I just explained a bit about what the overall kinds of areas are of the consensus statement, and I'm going to hand it back to Diana because she's going to talk about what the recommendations are for healthcare providers and social service providers. And just a little context is that these are very high kind of level overarching points that are made in the consensus statement, but there's a lot more context and pieces that are not included in this webinar, so I encourage you to kind of download it and take a look at it. But I'm going to hand it back to you, Diana.
Thank you, Maureen. Yes, so going to the slide of recommendations for healthcare and social service providers, one of the first recommendations that we decided upon was to provide low barrier, seamless care and linkage to all trans clients. Also, services should be designed and implemented with a trans and trauma-informed approach, and recruit, hire, and promote trans providers, and probably more specifically, trans providers of color. And so, and it was a lengthy discussion that we had, and many opinions, because many of our trans leaders throughout the country, we have different lived experiences and different backgrounds. And so, but some of the central themes and some of the recommendations that we all agreed upon were these few here. The first one is really important as far as access to health care. We want to make sure that medical institutions or organizations don't develop a gatekeeper mentality or a gatekeeper approach. And I mean by that is that sometimes medical organizations require a trans patient to see a psychologist or a psychiatrist or a mental health provider at times, you know, in a sense to prove that they are trans. And so making sure that your organization provides low barrier or no barrier and seamless care and linkage into healthcare is crucial. And also making sure that the programs are designed with trans input and buy-in, and then also definitely from a trauma-informed approach. Historically, we live with stigma, shame, guilt, and fear that causes trauma, and sometimes everyday experiences is a microaggression and triggers that trauma for us. And so making sure that services at your institutions or organizations are based on a trauma-informed, and making sure that you know how to handle crisis interventions when they come to your organization, and using the trauma-informed model. And then, of course, making sure that trans people are behind the desk, working side by side with you. That not only speaks that you are passionate and you are empathetic, but you are invested. You're putting the money where your mouth is at, and you're actually recruiting and hiring and developing competent trans providers. And that says a lot. Okay, and then of course also making sure that your policies, institutional policies, are incorporating trans inclusivity. Okay, the next slide is again recommendations for healthcare and social service providers. We decided upon having social providers and healthcare providers affirm all gender identities and presentations, no matter of our morals, values, or beliefs or attitudes. Making sure that providers must educate themselves and develop capacity to serve trans clients, and engage in continuous evaluation of trans client satisfaction. And I want to go back to the first one, affirm all gender identities and presentations. Our community, the trans community, is a very expansive community. There's a lot of sub-communities underneath the term transgender. And so we're seeing an influx of gender queer, gender nonconforming, gender non-binary. And so for older folks, older generational folks like myself, I was born in the 70s, and transgender didn't even come to our vocabulary until the 90s. And so seeing people identify as gender queer or gender nonconforming or gender non-binary or however they want to identify, it's reprogramming my brain to say that the world is no longer in a binary state, no more longer female and feminine or male and masculine. And so making sure that you're having these uncomfortable conversations with your staff so you don't have these uncomfortable conversations with your trans patients in front of you. Also making sure that your providers at your organizations are culturally competent, but then also medically competent. So many schools and universities throughout the country don't have a curriculum in their medical schools in regards to trans medical specialty programs. And so if your medical provider is struggling with providing trans-affirming services, allowing that medical provider to receive training, and that might be going to another clinic and shadowing another provider who's doing trans specialty services and who is a leader in that community, which is really important, and making sure that not only just one provider is competent, but making sure that several providers are competent, because you want to make sure that the continuum of care and the continuity of care is not interrupted. When you only have one medical provider at your institution and they're gone for a week on vacation, well then who's going to see the trans patients? Well, you have to have a plan where everybody on board should be providing trans-affirming and medical services, okay? And then making sure that on an ongoing basis, you're engaging the trans consumers through surveys or focus groups or town hall meetings as far as client satisfaction and consumer outcomes and measurables are being met. Okay. Next slide is for Maureen.
Okay, thanks, Diana. Thank you. Okay, so let's talk about the recommendations were made for funders, but I want to tell you first just briefly that even before we had this think tank, that before I kind of became a consultant on my own, as I mentioned before, I worked at Age United, and at that point I had met with the Positively Trans group out of the Transgender Law Center. And I am just going to give a big old shout out to TLC and the Positively Trans members and Cecilia Chung, who's helped move that forward. And a lot of those members were at our think tank. We did a shout out in the beginning to all of you who are think tank participants who are on this call. And I was asked at that point to come meet with the Positively Trans to actually do a little training or booster on grant writing. And the honest truth of what happened was, as a representative of Age United, I got schooled a bit. And I got schooled on, on funders in general around transgender organizations and coalitions. And what I heard was, you keep telling us to apply. You keep telling us, and we do it over and over, and we are consistently rejected. That is not okay. And I heard, funders either have one trans person on a selection committee or nobody of trans experience on a selection committee, and that's not okay. And even if you have one person, that person's going to have conflicts because they know a lot of the folks applying, or they're kind of tasked with making the trans case to all the other folks on that funding committee. So that's a setup for transgender groups. I also heard things like, we're not trusted in the kind of TA, technical assistance, that we need. Funders come in and they tell us what they think they need. And that's not okay either. And there has been some interesting kind of studies done globally and in the U.S. around what funders support trans groups for versus what trans groups think they need. And often it's very different. So there was a slide a minute ago Diana was talking from that said trust Black trans women, and trust transgender communities, particularly trans people of color, when they tell you as a funder what they think they need. So that's a really kind of important point, and something that Age United has taken to heart. And actually started a trans funding initiative. And on that trans funding initiative, which Shannon runs, I'm really pleased to say that 8 out of 9 selection committee reviewers were transgender, gender nonconforming people. So that's a way that funders can take this input and actually do something with it. I do, however, want to tell you that on the consensus statement, there were key recommendations that the group came forward with. And that was including trans leadership in all aspects of funding initiatives. And that begins with the design of a funding initiative that focuses on transgender communities. Or if it's not a trans-specific initiative, it's going to impact the trans community, and you want them involved in this initiative. So you have to have them help design it. You have to ask for their help in designing the request for proposal. You have to ask for help in thinking through what the implementation looks like, and you need their help in figuring out what is important to evaluate. So funders need to be kind of humble and come to the table with trans leaders. Recruit and hire trans staff in funding organizations, in philanthropy. I was just at a meeting in New Orleans of very progressive funders, including a lot of LGBT funders, and there were trans philanthropy staff there saying that they could probably count on 2 hands the number of transgender professionals who are in philanthropy. So funders need to really kind of invest in trans leaders in philanthropy and be role models in doing that hiring. Because if you are a funder and you're telling aid service organizations, you don't have diversity, you don't have trans staff, well, funders have to walk that walk too, right? They have to do that hiring too. A couple other recommendations for funders was to create innovative low-barrier strategies for trans-led organizations. And again, that goes back to what I heard from the Positively Trans members was, your logic model, your SMART objectives, your, up to 15 pages of narrative, you're not going to get that from us. You're expecting us, to fit as a square peg in a round hole. And so what are you going to do to meet us there? And actually some very small kind of grant making for transgender folks by transgender folks has happened in the past and informed now AIDS United's grant making around being able to do phone interviewing for grant making, about being able to do a Skype presentation that follows the RFP but talks the grant makers through it. And I'm really proud to say that AIDS United has adopted some of these new and exciting, innovative ways to do funding. And then again, I already mentioned, letting folks really identify the kind of technical assistance and capacity building that they know that they need. I think that is basically what I was going to say about the funder recommendations. So I'm just going to kind of hand it back to Shannon and see if you think we missed anything.
Maury, I just wanted to quickly add to the last discussion of funders is that one of the things that was innovated that came out of the transgender think tank is that the option for funders to have for community members who are applying for funds that you can do the paper application, but also be innovative by saying there might be a video application process as well. So that lends a more inclusive, accessible environment for people whose strong points are not writing or may not afford an effective grant writer, but they can really share the story on camera. And so thinking outside of the box on how you would receive funding applications and being creative.
Thank you, Diana. That's great.
At this point, we're going to open the webinar up for questions. The webinar is in listen-only mode, so please type your questions into the Q&A box. We will read your questions aloud and answer them. We have 15 minutes left in the period. Whatever questions we do not have time for, we will answer in an additional PDF document that we will upload to the AIDS United website along with the recording of the webinar and the slides. So let's take 2 minutes for folks to put their questions in. We have some really wonderful presenters, so I would love for some great questions. They'll be able to share some wonderful information with the field.
And while you're typing your questions, if you're interested in getting some free results-driven technical assistance on some of the items that we've talked about in today's call, you can contact the Getting to Zero Capacity Building Assistance team here at AIDS United at cba@aidsunited.org. That's CBA as in Capacity Building Assistance. So cba@aidsunited.org once we're off the webinar, and you can see if they can help you out with some of the stuff that you'd like to implement. And we're looking forward to folks' questions. So while we're waiting for other folks to submit their questions, I'd like to ask Diana and Maury both, what do you think is the most important suggestion from the consensus statement that would help clinical providers, social service providers, and funders step up in their support of the trans community?
Well, I'll jump in, Diana, and then I really want to hear your thoughts too. I think the discussion around low barriers, you know, and heightened access was very powerful in the think tank, and I think there's a lot of context to it that you can't always see in the bullet points or recommendations, but you know, there was a conversation about having healthcare providers understand that when a transgender person shows up 2 hours late, sometimes it's a miracle that they showed up. That for some people, stepping outside of their door every day is traumatic, and you know, there's a wondering, am I coming home tonight? Like, there's so much, you know, there's so much power and resilience in the trans community, so I don't want to paint it in a negative, all in a negative light, but really understanding, you know, I don't have money for bus. I've got to scramble that together somehow. And so really kind of having providers create flexibility, create alternative hours, create drop-in hours, have a little food there for folks who don't even have money to buy food. If you really want to get people in there whose HIV issue might be number 5 on their survival list, there's got to be better ways to kind of welcome people in and make it more accessible. I think that really struck me. How about you, Diana?
Thanks, Maury. Yes, I agree. You know, making sure that we implement low barrier or seamless healthcare in order to provide linkage services is crucial. Because due to financial hardship, like Maury was explaining,
I cannot hear Diana. I don't know about anyone else. I just saw a comment.
You know what? The sound just cut out, but it just came back, perhaps?
Diana, are you there?
Oh, no.
We might have lost Diana. Hopefully she can call back in.
Hopefully Diana calls back in to share what was most powerful for her. Well, while we're waiting for the sound to come back on, we did get another question in. So Maury, I'll direct this to you. Can you give an example of a successful trans-affirming organizational shift that you're aware of, a service provider or community organization that, quote, figured it out?
You know, that is a great question, and hopefully we'll get also Diana back on the line, because I think she has a lot to say about this. And, you know, I've heard a few stories of kind of community-based organizations that went from simply kind of having a seat on a community advisory board for trans folks to actually expanding that to get trans folks on not just an advisory board, but their board of directors, but really investing in mentoring and training that person so that when they come to the table, they don't feel like, they don't have the context to know what it even means to be at that meeting. I've heard of groups kind of being able to do that, to invest in the training and mentoring involved to increase the voice to the organization. And then I've heard of groups who are really, in process with this, and I don't want to just hold it up as, these are the great groups, they've done it already. I used to be a director of nonprofits, and I know change is hard and takes a while, but there are groups that are also trying to look at their hiring practices and trying to look at what is it we've required of certain positions and why, and is that absolutely necessary, and can we have a different way of looking at life experience and who the trusted people are to the communities we're trying to serve. So they're trying to kind of change some of their hiring requirements to let more trans folks get paid employment at organizations. So those are a few small examples that I know of. And I don't know if Diana's back on to answer that too.
Another question came in. What would you say to an organization if you're trying to implement more trans-affirming practices who says this is too hard or we don't have capacity to do this right now?
I would acknowledge that maybe it is going to be hard. But if you want to be an organization with integrity and really reach the most impacted communities, which really we're talking about the communities that are facing the most oppression. If you want to do that, then the hard is going to be part of it. And if you peel back, and it's important to peel back and look at maybe why you're not able to reach them, why they're not coming in, why they're not, participating on certain, whether it's advisory boards, that if you can hold that curiosity and know that figuring it out is going to make you a stronger organization, you're going to be more successful. So I feel like trans leaders want the opportunity to be a part of things. They want to be at that table. So I think investing in some curiosity, some listening, I think a lot of listening is going to be required. And I think sometimes it's also hard to sit with the anger that some trans activists and leaders have, but it's very real. And I often think, if your community was being murdered or oppressed at the level that trans women of color are, you might have some anger too. But I think if you can sit and listen and understand and become an ally, it's going to carry you a lot farther than you think it would.
Thank you, Maury. Diana is back on the line. Diana, we've had a few questions while your phone was on silent. Two questions. One is if you can tell us about what you think is some of the most important or powerful advice or action step from the trans consensus statement. And then the other is, can you give us an example of a community organization that has kind of, quote, figured it out or is doing it right to do trans-affirming programming or services?
Sure. I think, I'm not sure when Maury asked for my participation as far as the key outcomes, I guess, and Maury discussed making sure that organizations are developing low barrier access to care programs. And then I chimed in that I agreed, and then also making sure that we hire trans people, and trans people that reflect the demographics of the community that you're serving was also duly important for me. In regards to the question, I can't iterate this enough, and I think it was a large consensus of the folks in the room, is that trans people are capable, trans people can work, trans people are powerful, but trans people are smart, and that given the opportunity, we can really become successful, and we could really create an innovative, holistic, patient-centered model of care for any organization. But sometimes we lack the opportunity, and so I would press for any medical organization or nonprofit or CBO listening today is that making sure that you invest in the trans community. If you're going to be serving the trans community, that you really want to invest and hire trans people. You want trans people sitting behind the desk, so it empowers the trans patients or clients that come into the doors like, wow, trans people can do it too, wow. And it gives them hope. They might be struggling with instability, housing, or going through intimate partner violence, or lack of food or clothing, but when they see a trans person behind the desk, it gives them hope and it gives them meaning and it gives them inspiration. And so, you know, besides being culturally competent and making sure that your employee status quo is met, but you're really making a difference by hiring trans people, and especially trans people of color if they are the patient demographics. The program that I see that is doing a great job in incorporating all this is, and I always like to brag about my own agency, the St. John's Well Child and Family Center. Our Transgender Health Program was developed 3.5 years ago with only 6 to 9 patients our first year, and now I get to manage a program, one of the fastest growing trans specialty programs in the country, and now we have over 1,800 patients that we link to care. We provide comprehensive health services, medical services, behavioral health, dental services, hormone medications, gender-affirming referral letters, domestic violence assistance, legal name change, a patient advocate that all they do is making sure that they fight with the insurance carriers and making sure that their life-saving medications are being approved, and they are approved for lifelong, not every 3 months. We have homeless services, substance use services, we have a food pantry, we have a clothing pantry, we have social groups, we have support groups. We incorporated many of the holistic models that are needed to address not only their comprehensive health care needs, but also we address the social determinants. So we really created a state-of-the-art one-stop shop. And the more encompassing and comprehensive your program can be, where they don't have to go here or there, you know, especially if they're lacking finances or reliable transportation, you're not going to send your providers to 2 or 3 outside community resources. If you can have them in-house, even better. Or having those organizations come to you on a particular day of the week or particular hours where people can utilize legal services if they're being evicted or if they're being wrongly discriminated at work or what have you. But making sure that your organization is all encompassing and very comprehensive, very patient-centered, and very holistic.
Great. Thank you so much to both of you, Maury and Diana, for your amazing expertise and insight. This has been a really fantastic webinar. We really appreciate your time. We also want to thank everyone who called in and for those folks who asked questions. Just to let you know, and you can pass this word on to others who may not have been able to make the webinar, the recording and slides will be available on AIDS United's website in the next few days. And again, I want to thank Maury and Diana for their time. Do either of you have any last thoughts before we close?
I don't. I just want to thank everyone for listening in, and I hope that you'll be able to use the consensus statement and kind of look at in your own community how you think things are going and use it as a tool, and really appreciate you being the allies that you are, many of you wanting to listen in and learn.
Mm-hmm. Yeah, and I just want to echo, Maury, you know, they say there's a saying that the road to hell is paved with good intentions, and I think this document that we created, this consensus statement, really talks about the good intentions and how you create those good intentions into concrete actions, and that's very important. And sometimes you may not know the answers, and that's okay. And you may be uncomfortable with gender identity and gender expression, and that's okay too. But the willingness to become an ally, acknowledge, evaluate, be aware, and then also to be a champion for change, because we're not going to be able to change the structural oppressions against trans people without our cisgender counterparts and our allies and our champions. So we really need you to step up on our behalf and make sure things are implemented where trans people have access to health care. The trans community is tired of us being passed out condoms. We need economic opportunities in order to change the epidemic of HIV. Give us an opportunity to work for you, so then we have an optimistic future for tomorrow. But if we don't have a purpose to wake up each and every day, there's no meaning in our lives, well then what's to say that I'm going to protect myself today if I don't think I'm going to have a future tomorrow? So also keep that in mind. By providing economic opportunities, giving a hand up rather than a handout is crucially important to making sure that your programs are innovative and culturally competent and trans-affirming.
Thank you so much, Diana. Thank you so much, Maury. Thank you so much, everyone, for calling in. We wish you all a wonderful rest of the afternoon. Have a great day and a great weekend. Bye.